Hello friends. Now I should be telling you something about lumbar disc surgery. A very common problem in people who sit down or who have desk jobs, have to sit in the chair for 15, 16 hours a day, and then their back starts paining, and then they come to the doctor, and then it is diagnosed that they have a spinal ailment, spinal problem, where there is a disc in the lumbar spine giving pressure to their nerve roots. They often come with back pain and the pain in the leg, either left or right, sometimes on both the sides. Now, what do we do with these disc prolapses? Ideally, when spine is getting stressed out and the disc is getting desiccated, or if there is a problem with the disc and its integrity, it loosens, degenerates, and causes expansion, protrusion, and that protrusion comes on the nerve root, causes pressure on the root, and the root or the nerve starts shouting, and that's a pain. And that pain disappears, becomes less when they take rest, and it comes up again when they stand, walk, drive, sit, work. How do we deal with these problems? There's a great confusion about how to treat these patients, whether with conservative line of treatment, rest, exercise, or straight away take them to operation theatre and do surgery. This dilemma confuses people, especially these patients, where they get different advices from different doctors. Now here I'll tell you today what should be the correct approach to these particular problem. Whenever you have back pain and pain in the leg, and when you are investigated with MRI, which is a gold standard for diagnosis of disc prolapse in the lumbar spine, and once this diagnosis is made and you are qualified and it is told to you that you have a disc prolapse causing pressure over your nerve root, the first approach is take rest, because it may be one level, two level, it may be one root or second or third root or whatever. But the basic is to put yourself to bed rest. Now, the prerequisite before all the treatment begins is bed rest for 15 days. Almost 50 to 60% of people with 15 days of complete bed rest gets cured with from this particular disc prolapse and its problem like radicular pain. So pain disappears. In almost 40 to 50% of the patients, that is in my experience as a neurosurgeon. So the first prerequisite is bed rest. If you take that stringently, very strictly, you will see the results. And in spite of all that 15 days of bed rest, if pain still persists, then you probably have to go back to the doctor and he will take a decision about the surgery. Now, when it comes to justification of that decision of surgery, there are only 4 clear-cut indications for surgery. The first, if you have persistent or progressive neurological deficit in the form of motor deficit. Now, what is motor deficit? The nerve root of the spinal nerve root, which comes from the lumbar spine, goes into the leg and it supplies to your muscles of your leg, calf, toes, thighs, so on and so forth. And when there is a deficit or dysfunction, that means weakness of any of these muscles, persistent, progressive, you are a candidate for surgery. That's number 1. Number 2, The nerves which are getting compressed in the spine do have function called as sensory function. Now, what is sensory function? The sensation of your sole of the feet, sensation over the dorsum, that is the top of your foot or feet, sensation all along the lower limb. If it becomes less, objectively less and hampered, then one has to consider surgery. That is number 2. Number 3, if by any chance with severe radicular pain, if there is a urinary incontinence, means person cannot initiate the function of urination, or if urine cannot be passed and it gets blocked. So each way, whether it is incontinence or if it's a retention, any of these functions, if causing difficulty with urine passage, then you are a candidate for surgery. And the last, 4th one, is excruciating pain. If there is a severe pain which lasts for few minutes to few hours, it doesn't allow you to do your routine daily work. Your whole mind is on that particular severe pain which is there constantly troubling you, and it's not allowing you to live your normal life properly, peacefully, then it is one of the indications to do the surgery. So, in a nutshell, I would tell you again, if there is a motor deficit, if there's a weakness, if there is a sensory deficit, means if sensation is lost, if there is a urinary incontinence or disturbances of urinary function, and last, 4th one is excruciating pain. These are the 4 major objective points under which surgical decision is fully justified. If none of these are there, probably your disc disease may not require surgery. So keep in mind, and this is a general knowledge for all those people who have a lot of confusions about surgery versus no surgery, because the advices which come to them from different doctors, surgeons are different. So I hope this particular video has helped you to have some insight about your own problems of either back pain or pain in the leg due to lumbar disc prolapse. Thank you.